Hello, my name is Heather DeVries, and I want to talk today about maternity health care around the world. There are so many different cultures around the world and so many different experiences that all women have. And I became very interested in this at a very young age, and this is something that's always grabbed my attention. And I've always been fascinated by maternity care and both prenatal and postnatal, and as well as the labor process. And one of the things I find interesting is about how different cultures impact the way different women experience the birthing process. The birthing process is the same all the way around. Um, every woman has to give birth the same way, either C-section or a normal vaginal birth. However, their experience during that is different and it can change all around. And this can have a very high impact on maternal death and infant death. And I found it interesting, to look at the mortality rates and to look at um, everything that these women experience and what can contribute to it. And if there's a way that we contribute to it, then are there education or services that can be provided to help eliminate that and help lower the risk of mortality and of the mother and the baby. So this is a picture. These are pictures of maternity wards throughout the world, and in some places they're placed in the same room to give birth. In some areas they have to wait outside in line before they can get their prenatal care. Um, this is the traditional American way to give birth in the hospital with baby monitors and everything like that. Um, I did not specifically go into the U.S. Experience because we pretty much understand what the U.S. experience is. I wanted to focus on what other cultures are. So this is a map created by Max Fisher in 2013 from the Save the Children data. And this shows like the best places and the worst conditions for mothers. And you'll notice that the darker blues are where it's best to have a baby. It's the safest conditions. That's like Canada, Europe, Australia, New Zealand. These are the places. Now, all these places do have government funding for insurance and government insurance. And they also have access to higher health care. The worst places are in Africa and some of these poor countries around here that do not have access to good health care. These are the antenatal care statistics. According to UNICEF, only half of the women in the world receive proper amount of antenatal care. Antenatal care is another word for prenatal care that's what we call it here in the US. About 85% of the women have access to antenatal care, but most receive less than 4 visits before birth. So if they get one visit, is that enough? Is it not enough? And you'll see here that most of the North America do have access to, and they do receive more than 4 visits. What I find interesting is in the Europe, even though they have the government insurance, not everyone does have access to the antenatal. It does run similar to the map we saw in the previous slide, where these countries here, where they don't have access as much access here in Africa, and India and everything. These are the ones that were also having the higher death rates or the worst conditions for the mothers. So who decides the standard of care for the nations? So there is a World Health Organization. This is an organization that was created by doctors all around the world that come together and try to develop the best standards for each country to try to achieve or supersede. And these are the basics that everyone should have access to. Now, it doesn't happen in every country, but this is what their strong recommendations are for women who are giving birth. The WHO recommends antenatal care for each pregnancy, encompassing but not limited to nutrition intervention with supplements, vitamin D, calcium, iron, folic acid, vitamin A, micronutrient powders. The micronutrient powders are because most people do not have access to good food that have the nutrients. They should have immunizations for influenza and tetanus, prevention of preeclampsia and eclampsia. And preeclampsia and eclampsia is a condition that's caused by high blood pressure in a pregnant woman. Her blood pressure can become so high she can have a stroke, she can go into a coma, and she can die if the baby's not delivered within. It's like it's called toxemia as well. The baby becomes poisonous to her, and if she does not deliver the baby within 7 days, she will die. This is when the leading cause of maternal death around the world, but actually in the U.S. as well. And it's also the leading cause for premature birth. I've had family members and I've had friends that have had this, and I've seen the most extreme cases, and I've seen some of the more minor cases of it. The WHO also recommends labor induction when ready, or when necessary, sorry. Mothers should receive at least 4 postnatal visits. That means after birth, so 1 being a home visit. Breastfeeding should be exclusive until 6 months. Infant immunizations, mothers should be assessed for postpartum and complications, and counseling should be given to all women. This is not just for like postpartum depression, that's part of it, but also nutrition counseling and supplemental counseling, and how to clean and how to disinfect, and hygiene and proper caring for the baby. Mothers should also be given prophylactic antibiotics, and steps should also be taken to prevent postpartum hemorrhage, which is bleeding, which is another cause of death of the mother. World Health Organization. This is what the propaganda that they have put out there in different cultures to try to teach women that it's okay, that you have access to this kind of care. This is why it's important, because so many cultures are based off of ritual and familial recommendations and what the family says, and they're trying to shift and do culture shifts, and this is very difficult to do. So they're trying to get the word out and let women know and understand that they have a chance with their baby if they follow proper care. These are 2 more that they have. So there's also the Nordic Federation of Societies of Obstetrics and Gynecology. It's called NFOG. NFOG is a federation of 5 national societies of obstetricians and gynecologists in the Nordic countries: Denmark, Finland, Iceland, Norway, Sweden. We'll talk about Sweden later. But all of these have some of the highest birth rates in the world. They have the best birth rates for both the mother and the baby, and they have the best governmental support of the mother and baby. They have the best experiences, and so I think this is something that we really need to pay attention to. I know we have the WHO, but maybe we should also be looking at the Nordic Federation. Federation was created to promote education, share scientific advances, and create a general sense of cooperation between the 5 countries represented. Strong recommendations for NFOG for antenatal care is folic acid given prior to pregnancy. So this is a little bit different than the World Health Organization saying that a pregnant woman needs folic acid. We know that. We understand that. What they're saying is any woman who's expecting to get pregnant should already be taking folic acid and have that in their system before they get pregnant. Every expecting mother should be enrolled in an antenatal program. First visit should be between the 8th and 12th week of pregnancy, and they should be completed by a midwife or general practitioner. Record keeping will be on the health court for gravidae, and gravidae is another word for pregnancy, which is a standard electronic admission form that follows the woman between doctors and hospitals. So this allows continuity of care, and this allows for, if she ends up at a different hospital, that the doctors understand exactly what's going on at a moment's notice and can watch for complications. Continuity of care is prioritized for familiarity. As we already spoke about, healthy pregnant women should have at least 8 visits during the pregnancy, and pregnant women should have 1 ultrasound in the middle of the 2nd trimester. Now this is 8 visits during the pregnancy, so we saw earlier in the slide that they're saying that most women don't even have access to 4 visits, so they get extra visits, and that's could be one of the reasons they have some of the best maternal care. So how different is the birthing process from one country to the next? So this is a comparison of 14 different cultures. We start in Bangladesh. In Bangladesh, women give birth surrounded by family and friends. It's considered a group activity. Home births are most common, and they can move around freely as needed. Hospital births are rare because of financial reasons, and movement is restricted there. So if they go to the hospital, they're going to be relegated to a bed. They're not going to be able to move around and everything. Expressing pain is considered shameful. They practice Moner Shashosh and Shoriler Shakati, which is mental and physical strength. There's a very severe social stigma with C-sections or episiotomies. This is something that I found in several different cultures, that C-sections are considered like a failure. Ranked number 7 in the world for having the most first day deaths, and this could be because of the C-section and episiotomies, and most women don't want them, and so the baby can die that first day because they're not able to handle the complications. In China, the families pay for the birthing expenses, even though they do have like a national health care. It doesn't cover all the birth. So hospital births are the norm, with the home births being for those who are poor or live in rural areas. They have luxury hospitals, which is reserved for wealthy women. And in those, I find it interesting that the C-section rate is at 90% in those, that's actually desired, that they don't want to go through the birthing process, they just want to have the surgery and deliver the baby. Middle-class women cannot choose their doctors, and they're placed with other women while in labor. There are women baby hospitals, which are like birthing centers here in the U.S. The midwives can do abortions and C-sections, and in these places, the C-sections are around 40%. So it seems a little bit more as necessitated. They still observe Zoi Z to sit the month after the birth and are only allowed to breastfeed their babies. This takes place at the maternal grandmother's home. During this time, they're not allowed to get wet, even to bathe or even brush their teeth. They cannot go outside. They cannot eat raw vegetables or drink cold drinks. They cannot do household chores. If they don't do it at their maternal house, they'll do it at luxury confinement centers. And even with all of this, China's ranked as number 4 in the world for having the most first day deaths, even though they have access to healthcare. And I found this interesting since they do have governmental healthcare, and also that the C-sections are very desired. They do have the one baby rule, and I think that might have been changed to the two baby rule now. So that could be part of it. In France, the national healthcare system covers up to 70% of the healthcare costs, and as well as additional plans. Nurses are sent to the after birth to teach the mother and to provide care. And in Germany, the midwives are required to be at every birth, not the doctor. The mother gets, my apologies, mothers get 98 days of full paid maternity leave and up to 3 years of unpaid leave with no repercussions from their employers. In Japan, birth is in the modern hospitals but unmedicated. Fathers can be present at the birth only if they take prenatal classes. Mothers are not allowed to scream in pain, and hospital stays are for at least 5 days. They do have a laying in for 21 days, and visits from friends and family are welcome. In Korea, there's a lot of superstitious beliefs. They cannot eat any unbreakable foods, so like cookies or crackers, because they'll break and then the baby will be sick. The mother needs to be surrounded by all kinds of beauty and positivity because then they believe that this will make the baby beautiful. If the mother eats duck, they believe that the baby will come out with webbed feet. Birth is attended by female relatives while the husbands are relegated to the waiting room. Majority of the births do take place in hospital. Expressing pain is shameful, but they use aromatherapy, acupressure, and music to help. Most women do receive episiotomies. One thing that I found the article said is that since most women receive them because they don't know that they can tell the doctor that they don't want them. Like the Chinese, the Koreans also follow a traditional sanhojori, a lying-in period for 21 days following birth. But they do not have the same strict rules, except that they cannot be around air conditioning regardless of the temperature. The Navajos, most of the Native Americans give birth in reservation hospitals. They are trying to revive the traditional home births, and the home birth has rituals such as the husband tying a rope or decorative sashes in the home, and the husband creating a birthing spot on the floor with smooth sand, sheepskin, and cloth. They participate in the birthing process by embracing the mother during contractions. The husband will tend the fire and make juniper tea to provide an aroma. And the mother will take her hair down and remove her jewelry, and a healer will perform a special ceremony. The healer does not participate in the birthing process. Only the mother and father deliver the baby together and alone. In Nepal, women are brought into the marriage after being purchased by their husband. The husbands and mother-in-laws make all the decisions, and the women cannot travel alone. And this is one of the main reasons they cannot go to the doctors or seek medical care, even if they're very ill. Because if the mother-in-law decides that they cannot go, they cannot leave. Home birth is the norm, while squatting and hanging by the hands in the ceiling. I'm not exactly sure how that would look. They give birth in a dark room with an attendant and the mother-in-law, but oftentimes the attendants give improper care and the women can die in the process. After the birth, women are placed into a dark room alone because they believe that the son has masculine energy and they're not allowed to have any access to any kind of men. They're also forbidden to eat vegetables because it may cause diarrhea. And this is something that I found in several different cultures, and it's maybe not that they can't eat vegetables, it's because the water that the vegetables are in can make them very sick. In the Netherlands, hospital birth is an option, but most people stay home with the midwives. The government, every woman who's pregnant gets a packet called a creme packet, and it's a home delivery kit, and it's basically all these items that you see here in the picture. It's for the midwives to deliver the baby. The government insurance pays for a week of home care visits for a nurse and for a nurse to cook, clean, and care for the baby. In Nigeria, 1 in 18 women die during childbirth. Home birth is a norm, with the woman being alone until after the birth. They can go to the hospital for the birth if they receive a voucher after at least one checkup. For superstitious reasons, they cannot give birth on their back and will generally kneel. There are no midwives, only attendants that can come after the birth to care for the baby. They bathe the mother in clean leaves and give her potassium and spices. Sweden, as we talked about, has one of the highest rates for mothers to give birth. They meet so many different criteria. They have the highest breastfeeding rates, the lowest infant mortality rates, the lowest maternal deaths. They have low C-section rates. Midwives are the primary caregivers with doctors for emergency purposes. Prenatal care is covered by the government. Hospital births are made comfortable with lounges and a birthing team. And they have birthing plans with choices as long as they get educated on those choices. Tibet, the woman will give birth alone, but sometimes a mother-in-law or husband will help. After birth, they believe that they're polluted, so they'll cut the umbilical cord from themselves with an unclean knife and wash it later. And this is something is very, very dangerous for both them and the baby, because that's how infections are traveled. So the umbilical cord is a direct access to the bloodstream of both the baby and the mother. Majority of the women will give birth in an animal pen. There's a very high infant mortality. 20 to 30% of the children will die in the first year. Hospital birth is rare because of finances and geographical access to the hospital. It's very mountainous, and it's just very difficult to track to get to the different locations. They have very high superstitious beliefs. And so even before the baby eats from the mother for the first time, they're given a special concoction to protect them. And one thing that's in the concoction I noticed was honey. And one thing I've learned is that honey is actually pretty fatal to babies in the first year. The child is named by religious officials, not by the parents. In Uganda, the home birth is the norm, but they're slowly moving towards Western-style birthing methods. Childbirth is called Lutalo Lawabakaila, or a woman's battle. Pain is inspected. It's normal, natural, but the woman is expected to transcend it and to win the battle. In childbirth, according to the Ugandans, is a test of endurance. And showing fear or weakness is not accepted in the culture, and women are expected to maintain the same workloads. So if they have really bad morning sickness, if they have really bad pains or any complications during the pregnancy, they're not allowed to complain. There's no sympathy. They still have to maintain their regular work. C-sections and maternal deaths are viewed as failure by the women for being weak. It's a high honor for women who give birth alone and natural. And so with this, maternal deaths are very high, about 310 per 100,000 births. United Kingdom, government insurance will cover the cost of the birth. All new mothers have up to 52 weeks of maternity leave. Most of it is paid. Fathers receive 2 weeks of paid maternity leave. Most of the care is provided by midwives. So basically that's the presentation, and I found how interesting it was to see the different cultures and how healthcare is provided, and how when they have access to certain healthcare, they have lower mortality rates. One thing I found interesting is midwives is actually much more preferred around the world, and as long as they're trained, they can actually help prevent a lot of births, with the doctors only being there for emergencies. Here in the US, it's the opposite. Midwives is very have so many regulations around them that midwifery is actually not as common in the US as it is in other countries. And I think that when the doctors are involved, that's actually when you can get a lot higher C-section rates, because this is a natural process. And yes, intervention is required a lot of times. It's not required every time, and I think sometimes that can cause more problems down the line. I hope you enjoyed.